Hello, my name is Birgitta. This is my OSAT for post-op exercises. To start, I will speak and communicate in a professional manner. I'm going to check the provider's orders, gather my supplies and my stethoscope, my incentive spirometer, and my tissues for coughing. Okay, knock knock. Hi, my name is Birgitta. I'm going to be your student nurse today. I'm going to provide privacy, hand hygiene, privacy. What's your name?
Harleen Mack,
And what's your date of birth?
11/16/1999.
Okay, and do you have any preferred pronouns
No.
and any allergies?
No.
Okay, so the doctor ordered that I come in and do some post-operative exercises with you today. These are to help with your recovery, make sure everything goes smoothly. Before we start, I would do a pre-procedure assessment, assessing for any respiratory complications with any history of diseases such as emphysema, chronic bronchitis, pregnancy, obesity, asthma, surgeries that have to do with the abdomen or thoracic cavity, and I would check for smoking history and hemoglobin levels. I'm also going to listen to the lungs. Okay. Breathe in and out for me. Okay. I would also listen to the right middle lobe and the 8 spots on the back. Okay. So next, can you just take a deep breath in, and then as you exhale, cough into this. I'm just going to feel your abdomen, okay? Okay, thank you. Can take that, we'll throw it away. Okay, I also assess for thrombus formation, so I'm going to take a peek at the calves. Just make sure I'm looking for any redness, swelling, pain, warmth, any tenderness, any asymmetry between the calves. I'm also going to palpate the pedal pulses, so dorsalis pedis and tibialis posterior. Do you have any pain in your calves?
No.
Okay. Alright, so we're going to go ahead and get started with the exercises and make sure that the patient is sitting upright in semi-fowlers or fowlers. If the patient has an abdominal incision, we're going to use a pillow to splint the incision. So we're going to hold the pillow like this so the patient is pushing on the pillow instead of directly on that incision. There are no abdominal incisions today, so we can just go directly on our abdomen. So to start, we're going to do some diaphragmatic breathing. I'm going to show you how to do it and then have you return demonstrate for me, okay? So you're going to start with having your hand midline at the base of your rib cage, and as you inhale, you're going to push your abdomen out towards your hand. Then you're going to hold it for 3 seconds, and then exhale through pursed lips as if you're blowing out a candle. So you're going to inhale and exhale. And when you inhale, you don't want to use your shoulder muscles or your chest muscles, okay? So could you show me just once? Okay, good job. I would have the patient show me 3 to 5 times to ensure they're doing it correctly. And then you will do this 10 times every hour while you're awake in this post-operative period. Next, we're going to do some controlled coughing. So, here's one for you. I'm going to do the same thing. I'm going to show you how to do it, and then you'll show me. So to start, you're going to take 3 diaphragmatic breaths. I'm just going to show you one so I can show you the coughing. So you're going to take a deep breath in. And then as you exhale, you're going to cough 2 to 3 times. And you're not going to inhale in between the coughs. It's going to be consecutive, okay? Can you show me? You take 3 breaths. Okay, so as you're taking those breaths and coughing, I want you to assess the sputum that you cough up. Make sure you're looking at the color, the consistency, the amount, and any odors that come along with it. And if any of that changes, I want you to let me know, please. Okay, so have the patient demonstrate 3 to 5 times to make sure they're doing it correctly. And then you'll do this 10 times every hour while awake in this post-op period as well. Alright, so next we're going to be doing, you can throw that away, right there. Next we'll do this incentive spirometer. So the incentive spirometer is used to kind of wake up the lungs a little bit more after surgery. The lungs go to sleep as the body goes to sleep when we perform surgery, so the incentive spirometer is used to help get the lungs to their normal respiratory rate. So I'm going to show you how to use this, and then I'll have you show me. So this is the mouthpiece of the incentive spirometer. Your lips are going to go around the mouthpiece. You're going to exhale and then inhale as if you're inhaling through a straw. As you inhale, there's a little ball that's in the incentive spirometer, and it's going to move up, and you're going to inhale until you reach a specific volume that myself, the respiratory therapist, or the provider gives the patient. So you're going to inhale, reach that specific volume, and then hold it for 5 seconds. And then after 5 seconds, you'll just exhale normally. Okay? So I'm going to have you try. Okay, as the patient is return demonstrating, I'm going to observe to make sure that they are using it properly, they're reaching the specific volume given, and that they're able to do the frequency. So you're going to do this 10 times every hour in this post-op period. Do you have any questions? Okay, you can take that. We're done with this one. Alright. So next we're just going to do some leg exercises. So if you don't mind just scooting down a little bit. If the patient had surgery on their legs, I would do the exercises on the unaffected leg unless ordered by the doctor to perform these exercises on the affected leg as well. So I'm going to show you how to do these with passive range of motion first, and then I'll have you show me after. So to start, you're just going to make circles with your big toe. Like this, and then the other way. So you're going to do the same thing on both feet. Show me. Perfect, and you're going to do this 5 times every hour. Alright, and then next you're going to do plantar flexion and dorsiflexion. So you're just going to point your feet and then flex them back. You can do it simultaneously, pointing and flexing 5 times. Job, and you're going to do this 5 times every hour as well. Alright, and next you're going to do some quadriceps settings. So you're going to tighten those thigh muscles and push the back of your knees into the mattress. Good job, relax. The same thing on the other side. Perfect. Okay, you'll do that 5 times every hour as well. And then one more, you're just going to bend your knee and then put it to your chest as much as possible. Okay, awesome. Same thing on the other side. Okay, and then you would alternate. Can you do it for me once more? Perfect. You're going to do it 5 times on each leg every hour. Okay, do you have any questions?
No.
Are you comfortable?
Yes.
Okay, so that concludes all of the exercises. If you do need anything, let me know. And make sure the patient is comfortable, side rails are up, collar is in reach, bed is low and locked. And after the incentive spirometer, I made sure that I assessed the patient's I did a respiratory assessment before I left the bedside, and hand hygiene, and that concludes my OSAT. Thanks so much.